It's called the MERS virus, that stands for Middle East Respiratory Syndrome. It's the type of coronavirus that causes coughing, fever and pneumonia, and it has scientists stumped. This family in Saudi Arabia lost their father last month after he caught the virus. One of his sons got sick too, but survived. Health officials are trying to work out how and if these outbreaks are connected. So far, all they know is family members are often affected, as are patients in hospitals, where people with the virus go for treatment.
The MERS coronavirus probably originally comes from bats, but that's not how people are getting infected. There must be some other animal species or more than one species that is infected that then transmits the virus to people.
A virus from the same family as MERS triggered the outbreak of severe acute respiratory syndrome, or SARS, in 2003. That started in Asia, but killed almost 800 people around the world. So far, cases of the new virus have been confirmed in Tunisia, Qatar, UAE, France, Germany and the UK. And over the weekend, 3 new cases were confirmed in Italy. Scientists are working to develop a vaccine and also exploring whether antibodies from those who survive the virus could be used to give others immunity.
To treat individual patients, we do have some information that's been published recently from Canadian and American researchers about antiviral drugs that inhibit the virus, at least in the test tube. And so one thing that I've been advocating for is trying to have a consortium of doctors that would offer clinical treatment trials, protocols to patients with this new disease.
The MERS virus is considered dangerous. 60% of those diagnosed so far have died, and the World Health Organization says it's a threat that needs to be taken seriously. But so far it doesn't appear to be spreading as quickly as the virus that caused SARS, and the WHO is urging governments to prepare rather than panic. Tarek Basley, Al Jazeera.